So we have quite a good joint program in applied public health, both Tbilisi Medical Academy and GIPA, which is quite different from all other public health education in Georgia. And maybe not only in Georgia, because we have really very important peculiarities just which is for our joint program.
So it's a new program, so that's why probably sometimes it's good to start something new, because you learn on the others' mistakes. And as you mentioned earlier, world has gained more knowledge on public health, and its public health science is developing very fast. So paradigms are shifting, so it's good that we are starting it now with more knowledge, especially after, as everybody knows, after the pandemic. Okay. So the lot of paradigms of the public health has changed. So we will try to be more competitive and more adaptive to the new challenges that the public health in the whole world has today.
Yeah, absolutely. And really in 21st century, public health is really challenging and multidisciplinary and interdisciplinary. And from medical sciences, by basic public health sciences, we are shifting towards other directions such as law, ethics, finances, communication, cultural situations, and so on. So we consider under our program really all these differences which occurs in 21st century world.
Yeah, as you mentioned, the public health approaches have changed as the humans during their history has been going far and far away from the natural selection. Now we have much longer life expectancy. We have different diseases that come in the elderly, and which were not a problem, not a challenge many, let's say 20 years ago. And now we have a lot of people who are older than 80, so the other diseases are coming. So the pattern of diseases have changed, approaches have changed, technologies have changed, but also the businesses have changed, and the system that manages today's health becomes more business-like, which is also the different challenge to the public health.
Yes, absolutely, I agree. Situation is changing, and with the aging, non-communicable diseases are more prevalent, but at this time, emerging and re-emerging infectious diseases is still a problem. Environmental health, maternal and child health, and that's why in our program we consider the variety of optional courses from environmental health and planetary health till, I don't know, the laboratory in public health, which is a very new subject in public health. And it's just in our programs that we have laboratory in public health, and there is other geographic information systems which we provide. Just our program is providing this program, and this is really very important. And also the joint program. There is the only our program that is joint program. Yeah, and these partnerships in this developing in 21st century in the education, it's really very important, because we're sharing ideas, we're sharing technologies, resources, and so on, and we both our institutions are having benefits with this. And the old education system really pros. There is a bunch of partnerships in education which really are successful, but to be successful, we have to carefully find our partners, and I think we are successful to find each other.
I also hope so, because it's very important to understand that there are not much knowledge out there. So because of the very, very quickly changing environment, we don't know everything, and all our old knowledges may not be applicable to these new realities what we face now. And also Georgia, the public health professionals quite few. So it's good to find the ways of partnership so that we can join our efforts and develop a better program as we could do the alone.
Yeah, because Tbilisi Medical Academy has its strengths in medical field, and GIPA has its strengths in other
Yeah,
fields,
on
like
public
research,
policy and
yeah,
the management
yeah,
issues, yes, of course. Yeah.
education, yeah. So it's really good partnerships, and we do hope that it will be very, very successful. And also, our program is applied public health. We are really emphasizing practice. So this practical part of our studies, it's really very important, and we have a collaboration with different organizations working in public health who are very successful in Georgia, working on research projects, on management, and so on. So this is also one of the quite good part of our program.
It should be noted that for our prospective students, the biggest difference we probably will offer to them will be not providing them the ready solutions only. Of course, we will have the case studies and we will tell them and we will discuss the cases, real life situations. But also we just would like to provide them with the deep understanding of how the system works so that they can apply their knowledge, what they will receive during this program, to different models of the healthcare system, to the different countries. So they will be able just not only work in Georgia, but in other countries too. Because the problem is that today's healthcare system, as I said before, not all the countries who pay more for health having the better system. So it's not related only to the expenses. So a lot of countries who spend a lot for the public health may have very bad public health system, which is like case maybe the United States, which have probably best surgeons, best specialists. So you may have the best, one patient might get the best medical services if he can afford so, but at the same time the public health needs to be improved a lot, and then the beneficiaries of these programs will probably agree with me, so nobody is happy with it. So the most important thing is that in today's world we have to come to more cost-effective and efficient systems, healthcare systems, and for that it's just not enough just to copy some experiences from other countries, but every country has to develop its for own needs. And the best examples actually in today's world do not have most of the doctors per capita, do not have the most expenditure per capita, but the outcomes are better. So we have to study those examples and get lessons for us. So this is what we will just try to do with our students, prospective students.
Yeah, yes, absolutely. And also that we don't, we shifted from medicalized public health programs towards non-medicalized, and we allow all people with bachelor's degree just to come who are interested in public health, in developing public health system and having evidence-based, research-oriented and public health not in Georgia, in the world, I would say. So to come and to apply to our program, because we can have all of them without any medical education.
And also there is one paradigm which is shifted, and it's not probably always valid today, that the public health is only for medical professionals. So it's not true. It's not true because the public health is not only the knowledge of medicine. It's more of the whole holistic approach to the healthcare system, and that's why I mentioned that some countries who spend more do not get the better system. And very well developed system in Singapore, which has a little bit more population than Georgia. Of course, they have their pluses and minuses, and they're a smaller country in this geographical, let's say, size-wise. But they have like 2 or 3 times less doctors who provide much better health to the population, which is about 4-5 million people. So how can this done with less expenses? How can this done with changing the paradigm that whom we are helping the patients, helping the nurses, who benefits from the system? So 40,000 doctors or 3 million population? This is also very important questions, because the idea of the public health is understanding this system as a holistic, as a many actors with it. And if we know this system, we know how to operate it better and how to improve. Otherwise, if we will represent from one side, one stakeholder, and we will look from the policymakers, they will tell us that, okay, do not spend much. Ministry of Finance tell us, like, keep the expenses low. Medical doctors will tell us, pay us more. The hospital owners will tell us that DRG is bad, and so on and so on. But who is in the center of this? Probably, I think it's a patient.
It's a population.
Yeah, it's a patient population. And patient to be. Which means that not only current patient, but also the whole population. So the beneficiaries should be 3 million people in Georgia, for example, and 5 million people in Singapore, and so on. Yeah. And not the 40,000 doctors or like 15 owners. So this is a shifting of the paradigm, and this is how the system should work. In that case, because public health became a very powerful weapon in the political games also. So it's a very interesting area today, and I wish that our students will understand this also.
Yeah, and will benefit from this program for sure. So the goal of the public health is population's health, to have much less patients than we have it now. So to prevent diseases, health promotion, to have health promotion is a priority, but governments should have priorities.
Yeah, that's why I just mentioned that the most important thing is that it's natural from the service provider's side to wish for more patients. And from patients and from the government side, from state side, we will be looking for less patients and more healthy population, which, as I said, that these stakeholders, these actors frequently have very contradicting wishes and interests. So this is how the most important thing is that to make the good holistic approach to the healthcare is to find the balance between those conflicting interests and discuss these issues with the prospective public health officials, which we want to teach here, and we want to develop them as a public health officials in the future, them to understand the holistic approach to the systems. So in today's, let's say, Georgian reality, what we have manifolds increase in spending, which is good for patients, and all the families will feel that they are getting support from the state. But does it make nation more healthy? This is a question. So are the problems still with primary health? Are the problems still in disease prevention? So where should we focus? Which is more cost effective? Pay for the later stages at the tertiary hospitals, or this is the problem what we have today, in not only in Georgia but in most of the countries.
Yes.
And this is what we want our students to understand, that public officials should think about the patient-centric medicine, about the getting more spending less. This is how their mind should work.
Yeah, I agree, but prevention, health promotion, prioritizing these issues will really be very cost effective for every nation and every country. I also want to mention the infrastructure which both organizations have, and our students will have possibility to use conference rooms, libraries, and so on. We are equipped with very modern techniques and different electronic systems and so on. So we both institutions provide them with just best equipment and best infrastructure. And also it needs to be emphasized that the lecturers' human capacity of our joint program is very high quality as well. So they are just experts working in public health, health management, health financing, and so on. So that will also attract, I hope, our future students.
Yeah, as you mentioned, this breed of the program, the main breed is that we have experience more in management side and you have more experience in scientific and medical side. So joining our efforts will end up with better understanding and better facilities, better infrastructure, better knowledge transfer for the students who will come to this program.